Hello, everyone. Welcome to Health Professional Radio. I'm your host for today, Tabitha Moretto. Our guest today is Associate Professor Chris Askew, a Senior Research Fellow and leader of the VascoActive Research Group at the University of the Sunshine Coast and the Sunshine Coast Hospital and Health Service. Today, we're going to talk about the Cinderella disease, which many aging Australians are suffering from. Without further ado, welcome to the show, Chris. It's very nice to have you here.
Thanks very much, Tabitha. Nice to be with you.
My pleasure. So, Chris, please tell the audience more about yourself and the nature of your work.
So as you mentioned, I'm a research fellow and I'm an exercise physiologist with a particular interest in cardiovascular diseases. And we know that exercise is beneficial for a range of cardiovascular conditions, but importantly, many people with cardiovascular diseases have a limited ability to exercise and are limited in their ability to undertake daily physical activity. And the most common forms of cardiovascular disease that we're all aware of are heart disease and stroke, but there is another lesser-known cardiovascular condition called peripheral arterial disease, or PAD, and this is the condition that we call the Cinderella cardiovascular disease because it's the condition that's often forgotten about.
Very interesting. I'm curious, Chris, if you don't mind me asking, why is it called the Cinderella disease?
It's really a name. It was a nickname that was given to peripheral arterial disease because it's less well known than heart disease, which can lead to heart attacks, and cerebrovascular disease, which can lead to stroke. We all know of someone who has suffered from those conditions. But peripheral arterial disease, it's the same form of disease. It's what we call an atherosclerotic disease, or a disease that leads to blockages in the arteries of the body. And peripheral arterial disease in particular affects the leg. So it's called the Cinderella disease just because it's not so well known. But the consequences of peripheral arterial disease are quite serious. So it's important that we all know a little bit more about it.
Yes, very interesting. So tell us, what causes Cinderella disease and what are the symptoms?
So yeah, we don't refer to it routinely as Cinderella disease. We call it peripheral arterial disease, or PAD. As I mentioned, it's an atherosclerotic disease. And atherosclerosis refers to the build-up of fatty plaque within the arteries of the body, and these plaques reduce the size of or reduce the diameter of the blood vessel and impairs blood flow through the arteries. And in peripheral arterial disease, these blockages are most common in the lower limbs, in the leg. And with the build-up of these blockages, the narrowing and complete blockages of the arteries, patients with PAD have limited blood flow to their legs, and that causes a range of symptoms. And the first symptom, or the first sign of the disease, is that people can get leg pain in the muscles of their leg during walking. And this is a very specific symptom called claudication, or intermittent claudication. It's a pain that comes on when the person is exercising, and then when they stop and rest, the pain goes away.
I see. Thank you for explaining that to us. So, are there any available treatments for this condition?
There are. So, people with peripheral arterial disease are initially encouraged to adopt a healthy diet and to be physically active. If they smoke, they're encouraged to stop smoking. Sometimes the blockages are severe or severe enough that vascular surgery might be required. So procedures such as angioplasty, where the artery or the blockage is removed, or even bypass surgery. Unfortunately, in some cases, the blockages are so severe that there's been what we call critical limb ischemia, where there's damage to the tissue, and in some cases, amputation of the foot or even the leg might be required if the damage to the tissue is irreparable. Importantly, patients with peripheral arterial disease also have a very high risk of cardiovascular events. So while the disease causes pain in the legs, these patients are at a very high risk of having a heart attack, and they're at a very high risk of having a stroke. And this is one of the areas where we think exercise can provide added benefit. Our research has shown that if patients with peripheral arterial disease exercise as part of their treatment, that they not only improve their walking capacity and their physical capacity, that this exercise might also reduce their risk of other cardiovascular events and reduce their risk of heart attack and stroke.
Thank you so much, Chris, for explaining that to us. I would love to talk to you more, but we're running out of time. But before we go, Chris, what is your main takeaway message to all of our listeners out there? What would you like to tell them?
I think it's really important. I'd like more people to be aware of peripheral arterial disease, and often older adults who experience leg pain while they're walking just put those pains down to getting old, or maybe they think it's arthritis or some other condition causing the pain. Be aware that these leg muscle pains during walking might be a sign of peripheral arterial disease and a serious cardiovascular condition. So if they have any concerns, that they should speak to their doctor, and their doctor will be able to do the necessary tests to determine whether they do in fact have peripheral arterial disease.
That was a fantastic message. And lastly, for those who want to get in touch with you, Chris, how can they do that?
So I'm at the University of the Sunshine Coast, so they can find us on the internet by using their browser to go to www.usc.edu.au, and people can also email me directly if they're interested, and my email address is caskew@usc.edu.au.
Fantastic. Thank you so much, Chris, for coming on the show. It was a pleasure having you.
Thank you, Tabitha. Thanks for your time.
And that was Associate Professor Chris Askew. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. Show us some love by subscribing to our HPR YouTube channel. We're also available for download on SoundCloud and iTunes. I'm Tabitha Moretto, and you're listening to Health Professional Radio.